Hello everyone, welcome to our channel. Today we'll be talking about a question from the upper limb from MRCS. So here the question goes, a 10-year-old boy is admitted to the emergency department following a fall. On examination there is deformity and swelling of the forearm. The ability to flex the fingers of the affected limb is impaired. However, there is no sensory impairment. Imaging confirms a displaced forearm fracture. Which of the nerves listed below is most likely to have been affected? And the options are the ulnar nerve, posterior interosseous nerve, anterior interosseous nerve, axillary nerve, and the radial nerve. So the question here mainly is asking about the nerves responsible for the loss of flexion of the fingers, and plus there is no sensory impairment. To answer this question, first you have to know about the muscles and nerve supply of the upper limb, specifically the forearm. So the muscles of the forearm, we can divide the muscles of the forearm into two groups: the superficial flexor of the forearm and the deep flexor of the forearm. Among the superficial flexor, the flexor digitorum superficialis inserts on the middle phalanges and it causes flexion of the proximal interphalangeal joint. So the nerve supply of the flexor digitorum superficialis is the median nerve. And among the deep flexor digitorum profundus inserts on the distal phalanges and it causes flexion of the distal interphalangeal joints, and it supplies by the anterior interosseous nerve and ulnar nerve both. The medial half of the flexor digitorum profundus is supplied by the ulnar nerve and the lateral half is supplied by the anterior interosseous nerve, and flexor pollicis longus causes flexion of the interphalangeal joint of the thumb, and it is innervated by the anterior interosseous nerve. If you look at the picture, it will be clear that the flexor pollicis longus inserts on the thumb, causes flexion of the interphalangeal joint. Flexor digitorum superficialis inserts on the left. You can see the picture that the flexor digitorum superficialis inserts on the proximal interphalangeal joint and causes flexion of the PIP joint, and flexor digitorum profundus inserts on the DIP joint, distal interphalangeal joint, and causes flexion of the distal interphalangeal joint. So we can say that the main flexor of the fingers are all these three muscles, and all these three muscles are supplied by the anterior interosseous nerve except flexor digitorum profundus, medial half of the flexor digitorum profundus, which is supplied by the ulnar nerve. So if you look at the question, they are talking about the loss of flexion of the fingers. So in the broad heading we can say that the injury to the anterior interosseous nerve is responsible for uh, this uh, output, for this loss of flexion. The ulnar nerve also comes to this scenario, but it has little significance in here. So our answer is anterior interosseous nerve. Thank you for listening and stay updated.